Really, I specialise in treating people with neurological conditions. Common concern is confidence after something happens, whether it's a stroke happening or a diagnosis of a neurological condition.
Thank you for being with us today, Katie. Can I start by asking you just to tell me a little bit more about your background and experience and what conditions that you treat?
Yeah, so I originally trained as a physiotherapist and then after that started to specialise in neurology. Within the NHS, I predominantly worked in stroke. I left the NHS to study further and increase my educational side of my skills and completed a master's in neurorehabilitation. Setting up here is developing new clinical services for those with neurology, but also as we're linked to a university, there's opportunities for teaching and also carrying out research within the centre.
My next question about the common concerns or questions that you ask by those people and their family members. What are the things that they're struggling with?
Common concern is confidence after something happens, whether it's a stroke happening or a diagnosis of a neurological condition. People really lose their confidence in whether they can carry out their normal hobbies, interests, social activities. So quite a lot of my work is focused on exploring those things and perhaps supporting someone as to how they can do those activities, even if it's in a different way or an adapted way to how they were able to carry out their interests and hobbies before. But giving someone the confidence to get out there, because people often can become quite insular in their own home and start to lose the ability to use public transport, for instance, or go out shopping. And it's looking for ways that we can get people back out there and give them more confidence to participate in their lives again. So one of the other aspects that links with confidence is that people have a sense of grieving when they've suddenly been diagnosed with something. There's a feeling that they're grieving for their old life and for what their life used to be like, and they have to adapt to their new current position. And part of my role is, again, trying to help them through that process to see that there are improvements that can be made. There's ways that we can help people maintain their ability, and it might be, again, looking at ways that they can achieve their interests, their hobbies, getting out and being social, but perhaps just having to do that in a slightly different way.
Could you demonstrate for us 3 simple exercises that someone could do at home to perhaps help them with balance or mobility?
So there are some simple exercises that I'd recommend to help people work on their mobility and balance. The first one is just practicing sit to stand. So choosing a chair with a firm base and with arms on it, and then just practicing moving forward in the chair, leaning forward over your knees, and then pushing yourself up into standing. Once you're standing, really trying to extend up nice and straight, so you're engaging all the muscles in your legs and in your body, and then returning to sitting. The next exercise is a balance exercise, and this can be staged depending how difficult you're finding it. In research, most people lose their balance going to the side, so it's really important to practice some rescue steps to the side. So to start off with, this can be stood by a kitchen surface with your feet apart and then just stepping one foot over the other and then back to the other side. Once you've mastered that holding on, then trying to do it without holding on, and then starting to make that movement quicker so that if you do lose your balance, you're able to take that really important rescue step to the side to stop yourself falling over. And the final exercise I'd suggest is standing and just moving your body, because as we get older, often people can become quite fixed to the front and also slightly hunched, and those things make you more at risk of falling over if you're perturbed perhaps by someone knocking into you. So this exercise is carried out just standing. You can stand near a kitchen surface if you need a little bit of support, and then turning round to look as far as you can behind you one way, keeping your feet still, and then coming slowly back round to the front, and then turning round the other way as far as you can, and again coming back to the front.
Do you have any condition-specific advice for someone with Parkinson's to help with symptoms?
Specifically for Parkinson's, it's been found that you should focus on large movements. So when you are exercising, trying to do them with a real purpose and really big movements. So things like if you're performing squats, also involving your arms moving up in the air. When you're walking, it's really good to practice exaggerating your steps, because Parkinson's will tend to make you want to shuffle and take small steps. And the way of improving your walking is to really over-exaggerate your steps.
And have you come across any particular bits of equipment or gadgets that might be quite useful for someone around their home, just in terms of mobility and balance and things like that?
I think some of the most useful things I've seen are different types of stand aid or stand hoist. If you are assessed, it might be that one particular model doesn't suit you, but there could be other options, and it's really important, if possible, to keep some standing within your day, because it really helps with multiple different areas of the body to ensure that you are upright for part of your day. And then I think the other aspect is being assessed in your bathroom and in your kitchen. There's multiple different aids that can help you be more independent. And I know a lot of my patients enjoy being in the kitchen and being able to participate in some cooking. And there's a lot of things that perhaps for someone with stroke that you can use one-handed. There's boards where you can, with a little needle that you can actually stick an onion on and then be able to just chop with one hand. And it's really nice to actually ensure that people aren't just sat at home in a chair and not able to carry out some of the things in the home that they enjoy doing.
What help and support is available out there for families who are looking after someone who has a neurological condition and might need some rehab or support?
There are a lot of services that do support families and people living with neurological conditions. It can be hard to know what's in your area, so I would recommend that you do approach your GP or adult services near you to actually find out what is available in your area. Another really good area of support are some of the larger charitable organisations. So for instance, there's the Stroke Association, which has loads of useful information and contacts on stroke. Parkinson's UK for Parkinson's, and all of the more common neurological conditions do have these large support charitable networks.
Is there any information or support out there that you think isn't as well known about as it should be?
On networks such as Facebook, you can look up for your local community group, and that's a really good forum for actually finding information about services in the area and asking any questions that are specific to things you're actually looking for. Because if you don't know the answer, the likelihood is that someone within that network may be able to come back to you with a really valuable answer.
When you're looking after a loved one at home, it can feel really daunting, but it's important to remember you're not alone.